Center of this debate feels like a debate over health care. And you've said repeatedly that addressing Obamacare subsidies is a December issue, but families are making their open enrollment decisions in October and November. So why shouldn't Congress give families some degree of certainty in a landscape where their premiums could double if this issue isn't taken care of?
I'm not suggesting that we shouldn't do that. What I'm saying is we have to keep the lights on in the building so that we can have those discussions and debates. Republicans have made no assertions about how that will wind up, but December 31st is when the subsidies end, and so we have effectively 3 months to negotiate. You know, in the White House and in the halls of Congress, that's like an eternity.
Bottom line, should families plan on paying more next year for health care?
Boy, I hope not. I mean, we're working to bring costs down. We did that. We demonstrated it in the Working Families Tax Cut, the One Big Beautiful Bill, where we didn't cut Medicaid. We shored it up. We supported it. Why? Because we eliminated fraud, waste, and abuse.
That was part of my interview with House Speaker Mike Johnson. We've not yet aired it. You heard it here first. And that's as we enter day 6 of this government shutdown. I want to bring in now Democratic Congressman Greg Landsman of Ohio. You're joining us from home right now because the House is not in session. The Speaker has decided to keep Republicans home, and so Democrats were able to go home as well. But I want to get your reaction to that clip of my interview there with the House Speaker. When I ask him, bottom line, are Americans going to pay more for health care? He doesn't say no.
Yeah, because he knows they will. I mean, there are 3 really important facts about this. One, this is about health care. 24 million Americans are going to see their health care double. 4 million Americans are going to lose their health coverage entirely. This is in the next couple of months, and they're finding out now. They have to make decisions now. Number 2, health care is very popular. So these ACA subsidies that help people keep their health care costs down, 78% of Americans support extending those subsidies. And then number 3, Trump shutdown will end when Trump tells congressional Republicans to get a deal done. That the Speaker and the Senate Majority Leader, right, they control the House and the Senate. They need to sit down with Democrats and reopen the government and protect people's health care. That's when Trump shutdown ends. And, you know, this is urgent because people are getting these letters right now.
What are you hearing from your constituents about this? Are they blaming Republicans? Are they blaming Democrats? Do they just not really care who's to blame because they just want to see the government work?
No, they care deeply about this. They want to see the government work, and they want to see the president of the United States actually lead and get a deal done. And they care deeply, deeply about health care. And they want this fight to end with them keeping their health care and their health care costs lower.
You are someone, Congressman, who does have good relationships across the aisle. You understand where many, sometimes more moderate Republicans are at. Have you heard from any of them saying that they're uncomfortable with the Republican strategy here to just sit and wait until Democrats come around on a clean continuing resolution? Do they have some concerns about that at this point?
Yeah, I think they find themselves in a really difficult position because on one hand, they didn't want to cut Medicaid to begin with, but they did because the president is threatening to, run somebody against them in a primary. They like the Affordable Care Act subsidies because they know, like in my district, 30,000 people in my district in Southwest Ohio will see their health care premiums go up. I mean, double. They don't have that kind of money. And about 14,000 people in my district will lose their health care altogether starting January 1. That's not even including the Medicaid cuts. So, yeah, they're in a tough spot. And I think they would prefer a deal. They want to see the president say, fine, get a deal done, reopen the government, protect people's health care.
Congressman, House Democrats are going to meet virtually later tonight, virtually because you're all at home. What do you imagine the message is going to be from leadership as we start this now second week of a government shutdown? And what's your thinking on how long people should prepare to be in this shutdown posture?
I think Hakeem will tell us that he is trying to convince Johnson for a second week in a row to come back to D.C. The speaker decides, and he is pleading with Johnson, do not keep these guys on vacation. We're out now. We were in D.C. last week. We'll probably be back in D.C. this week, no matter what Johnson does, or at least most of us or many of us. But that to me is what I expect Hakeem to say is he is trying to convince Johnson to do his job, bring everybody back and get a deal done because this healthcare crisis is upon us, right? Long-term care facilities are already shutting down. Rural hospitals are already shutting down. Children's hospitals, hospitals in general are laying people off, and letters are coming to our constituents saying your healthcare premiums are going up.
And I heard Speaker Johnson over the weekend telling me that the lines of communication are open just moments after Hakeem Jeffries had said on Meet the Press that they haven't had communication between both parties since that Oval Office meeting that, of course, landed us in no different a circumstance than we are right now. A lot for us to keep an eye on. Democratic Congressman Greg Landsman of Ohio, I thank you for coming on and unpacking it with us to start the week.
Thanks, Allie.